Hi, Dr. Alfred Marquez here with Marquez Integrative Dental. Today I'm sitting here with Mr. Stephen Flores. And Stephen is actually going to ask me a few questions, things that he thinks might be interesting for you all to hear. So Stephen, take it away.
So, hi guys. So I have a couple questions for Dr. Marquez. I've been a patient of his for about 2 years, and he's been able to help me with all my dental care. But I do have questions because I do grind my teeth. So I have a lot of questions about grinding of the teeth. Now, I know at night I grind probably most. Sometimes my jaw locks during the day. So I kind of want to know how come I'm grinding, and then what I can do to maybe prevent it from happening. And I feel like my teeth could be wearing out a little faster than they should be. No, I'm not saying it's drastic, but it's more than I feel a 32-year-old should have. So those are some of the questions I have for you.
Okay, so tooth grinding is a complex problem. There's a lot of things going on, a lot of things happening. But what's the bad thing about tooth grinding? First of all, it can be traumatic to your teeth. It can cause wear of your teeth. An example is to wear down enamel. 1 millimeter of enamel would normally take about 100 years. Individuals have come to my office where they've worn down all the enamel, which is close to a couple of millimeters, and then some. And they've done it over a period of maybe 10, 15 years. So they're absolutely putting a tremendous amount of force on their teeth, and that can take its toll on the teeth, tooth wear, supporting structure, breaking teeth, cracking teeth, breaking dental restorations, on and on, just a whole lot of things. You mentioned that you notice it more so at night.
Right.
So we asked, okay, well, what's the difference? How come you're not grinding your teeth right now? What compels you to grind your teeth more so at night? Mm-hmm. And today we have more and more evidence that associates tooth grinding with actually airway. You say airway, well what do you mean airway? Well, what happens at night when we're sleeping? What happens to a lot of people? Not to everyone, but a lot of people when they go to sleep, they snore. You say, well, what is snoring? How come you're not sitting here and you're not snoring? Why just at night? Well, at night, as you go to sleep and as you go through the different phases of sleep, the muscle tone begins to change. Your tongue may drop back, the muscles relax, airway reduces, and as you have reduction in airway, there's more challenge to the airflow.
Right.
Tissues might start to vibrate. That's what we call snoring. Not in everyone, but that is reflective of a constricted airway. But in a younger person like yourself, your brain will sense, you know what, air isn't flowing the way that it should. Mm-hmm. Things aren't quite up to par. Airway is challenged. I'm going to initiate a microarousal, which might include a slight awakening or sometimes complete awakening. There'll be a compensation where you might clench and grind your teeth. Perhaps muscles tense up. You create a little more muscle tone, airway opens, the body's happy, and you sleep and you breathe better. But it might be cyclical throughout the night, where you go in and out, depending on the stages of sleep. So when you wake up in the morning, you feel, oh, I was working out my jaw.
Yeah, I do feel like that.
You feel like that?
Yeah, absolutely.
Teeth might be a little sore. Some people get headaches.
I believe, yeah.
But it can be traumatic, and it's nothing more than a sign and symptom of a bigger problem, a deeper problem, which is usually associated with airway.
Now, I guess as far as airway is concerned, what can I do to, for my airway? Because if
Okay.
my airway is like, I guess, narrower,
Yes.
then I guess it should be.
Yes.
What could I possibly do to prevent, you
Yes.
know, more complicated things from happening on that?
So the bottom line is this: if we were to say, okay, what's happening to Stephen, or what's happening to most anyone that grinds their teeth, or most anyone that has airway issues, what's the issue really? Well, what you would have to say is that the lower third of the face didn't grow and develop the way Mother Nature intended it to grow.
Okay.
Smaller upper jaw, smaller lower jaw, and the third component of the lower third of the face is an airway. So all of those things tend to be more reduced in nature.
Okay.
So in a younger individual, most young individuals will tend to compensate pretty well. But as we get older, a compromised airway might reflect itself as sleep apnea. We're hearing more and more about sleep apnea, and definitely has a lot of effects on your health, not just your teeth,
Right.
but on your overall health. That'll be a subject for later. But grinding airway is all reflective of a reduced airway. So what do you do and how do you treat it? When we look at tooth grinding, there's a couple of ways that I look at it. Let's say, for example, a person comes in and they say, you know what, my head hurts. I say, great. I think I know what's wrong. And I see them and they're banging their head on the wall. And I say, I can fix that. So I give them a helmet. They put the helmet on, still banging their head stops hurting, but I really haven't fixed anything.
Right.
I've only managed the problem. A better thing to do would be to, well, let me get you to stop banging your head on the wall, and you're not going to have the headache anymore. So this is kind of an analogy I use with tooth grinding. You grind your teeth, what can I do to protect your teeth? I can place a guard which will protect the teeth, and to a certain extent it could very well help you with your joint and your muscles, and depending on how we design it. But we're primarily protecting the teeth. We're keeping you from banging your teeth together.
Right.
So that's one approach. Another approach is where you say, well, what if we take it a step further, and what if we start addressing the airway? It's like peeling layers of an onion, because there's a lot of things that come into play. Everything from the size of the airway, inflammation of tissues, maybe diet, maybe the alignment of your jaws, maybe your tongue, maybe sinus issues, maybe tonsil issues.
Or all the above.
Just all the above,
Yeah.
but it's really a conglomerate of things that come together
Okay.
that can affect you. The thing is to identify what the problem is and then start treating individual issues, and it would probably entail a collaborative effort from different specialties to address it in completion.
Okay.
So that kind of is a long story short.
Yeah, that definitely, I think, answers my question, and it definitely has me intrigued to find out how to fix it.
Yes.
Because I do think it's important.
It's a real common problem. Airway is an extremely common problem. It's something that we're seeing. Signs and symptoms that can vary anywhere from, in younger children, attention deficit disorder, nightmares, bedwetting, to our older patients, coronary heart disease, stroke, Alzheimer's, dementia, just so many different things. And there's a whole slew of symptoms that can result from not receiving oxygen the way that we should.
That's crazy. I never really thought of that being the issue,
Yes.
but that's very informative. Yeah, I really like. I had no idea.
So take it serious.
Absolutely.
And anyone that has those issues, if you think we can help you, give us a holler.
All right, thank you, Dr. Marquez. I really appreciate it.
Thank you. Take care, Steve.
All right, thank you.
Sleep well.
Always.